Hello, class. This is your professor, Dr. Brian Lippincott, and I would like to give you a little quick lecture here on what makes trauma response more likely, more intense, or more complicated. For instance, as an example, there's an evidence-based treatment called seeking safety, which is specifically for women who have experienced PTSD and substance abuse. And those two, the reason why there's an evidence-based treatment just for that is that those two things co-occur a lot. For instance, people with PTSD, as you know, many times have trouble sleeping. And they may start drinking in order to sleep, and then they develop an alcohol problem secondarily, or some other drug to help them sleep. Then also, people that use substances to excess or use them negatively many times get themselves in situations, unfortunately, where they could be an accident or a trauma or many of these other things. So those two things are risk factors for each other. So let's just go over a little bit of the victim variables. The variables refer to most of the aspects where the victim is placed in the relevant trauma, but that nevertheless are associated with a likelihood of sustained post-traumatic difficulties. So what are the sequelae that happen afterwards? What are the things that are the major victim-specific risk factors that difference between just experiencing a trauma on one hand, which is not good, but also developing post-traumatic stress disorder symptoms of intrusive thoughts or avoidance, arousal, hyperarousal, those kind of things. Number one is female gender. So more likely to develop problems after stress. And there may be because there are sometimes different stressors depending on gender. Age, with younger or older individuals being at greater risk. Race, with African Americans and Hispanics as compared to whites at higher risk. Poverty and socioeconomic class, which you can see how a lot of these things can interrelate. Previous or coexisting psychological dysfunction or disorders. So, for instance, somebody could be 18 years old and experiencing psychosis and then because of the psychosis get themselves in a situation where they have a traumatic stress, or children could have ADHD, which makes them kind of have sometimes behavior problems, which can make it more likely that they'll experience child abuse. Less functional coping styles. So the people that have developed better coping styles are much better at dealing with the trauma. Family dysfunction and family history of trauma. For instance, trauma does happen to run in families, and sometimes, a parent will be abused, and then that will get passed on to the kid, either because the parent is turning their head to things or getting involved in abusive relationships with other adults, or there's just vulnerability there. Previous history, obviously, the more repetitive. It's really different to have a cop who's shot, who had a great life, great attachment, has great relationships, family history was fantastic, and they shot, which is a trauma, but we can really treat that in 10 to 12 sessions. When you have somebody that was abused as a 5-year-old, abused throughout their latency age period, they're 6 to 12, ran away home at 13 because of sexual abuse, got involved in relationships on the street, on and on. Those kind of chronic many traumas. For instance, some of our treatments like EMDR might not work as well because there's just so many different traumas to go through to kind of expose the client to. A hyperactive or dysfunctional nervous system, like now we have the whole thing we know about highly sensitive people. Highly sensitive people makes them the more vulnerable for child abuse. A genetic predisposition. Some people might be more vulnerable biologically or because of genetics, or there could be things like head injuries, playing football for 20 years, or something falling on your head, or other kinds of head injuries. Post-traumatic stress dissociation, having dissociative symptoms along with the PTSD is an indicator that the client may have a more difficult time recovering and may have more sequelae or things happening after that perpetuate it. So dissociation involving derealization, depersonalization, or cognitive disengagement from others. The time of the trauma can really, it's a coping mechanism that the brain and body has used, but it can be, unfortunately, it's like going into a trance. It can be really, really good therapeutically, but also you can go in a trance at the wrong time, or we can have trances that we go into when we're being hurt or whatever. Greater distress at the time of the trauma or immediately after. So we want to have quick response when there's a trauma and relate to that. When the likelihood of trauma exposure is equivalent for both sexes, like in the case of a natural disaster, some studies suggest that PTSD rates are approximately equal between men and women. At the same time, other large-scale studies indicate that even among victims of terrorist attacks, women and minority groups are somewhat more likely to develop PTSD than men or whites. This would be something that would be a great thing to do further research on. The characteristics of the stressor, the type of stressor, have been shown to cause more sequelae or problems later on. The most important thing that causes stress later on is in fact, they've done research that just shows that the violence, or whether you're hospitalized, or whether it was penetration and sexual abuse, these kind of indicators of the aggressiveness of it and that thing, are somewhat indicators for sequelae later on, but they're not the greatest indicators. The greatest indicator is the betrayal by somebody that you think, or you're supposed to, or you believe that you trust. So, for instance, as an example, trigger warning, this class is going to have a lot of examples of things. But for instance, being sexually abused by a parent is, even if it's just fondling, or not that just, but fondling, can cause many times more problems than an actual rape by a person that you don't know, never met, happened in some random situation, just out of the blue. The betrayal and the break of the object relations, or the attachment breakage, or problems, is really the issue that causes the most problems later on. Now, the one thing that makes it the problem worse about the stressor is the more it is intentional, that like accidentally having a trauma, like an accident, getting run over or hit by a car, that's not intentional, is much less. But for instance, we have a lot of shootings now. That's intentional. And the weapons they use are intentional. Those type of traumas, because there was an intention behind it, make it worse because it degrades our trust in humanity and other people, which is our greatest resource. It degrades our relational health. Obviously, life-threatening, your life being threatened is important. The physical injury you received, okay, but it's not the worst. The length of combat exposure. So the length of time, like going on having combat for 2 weeks is really different than having it for 2 months. It's really different than having it for a year. Constant. Witnessing death itself has been shown, actually witnessing a death and seeing the person actually expire has been shown to cause much more problems later on. The loss or a friend of a loved one due to the trauma and knowing what they went through. So our empathy gets hooked in, and it's kind of a good thing that we have empathy, but it can, you can't feel the good things in life if you can't feel the painful things in life. So if you block yourself from dissociate and stop feeling the bad things, you also lose your angels. Life-threatening illness, especially medical, painful events and procedures. I've had 2 hip surgeries and 2 knee surgeries, and some of those, there was some trauma involved. Unpredictability and uncontrollability. Feeling that you're in control. That's why anesthesia sometimes can be traumatic in itself, because you're losing control. Sexual victimization, because of the intention and knowing what the person knows what they're doing, and the whole degrading of you as a person. And obviously, longer duration and greater frequency. Types of post-traumatic stress. They vary in frequency, and it depends who the perpetrator is and who the victim is. And also, you always want to be aware in family systems, thinking of the traumatic triangle. I'm trying to make a 3, but my arthritis is getting my hands. So there's the victim, the perpetrator, the person who did, but there's usually, almost always, somebody that the person feels should have known, could have stopped it, allowed it to happen. So that comes up in counseling and can affect transference in the count. I've supervised many men and many women therapists. And for instance, if a woman is abused and she has a woman counselor and she was abused by a male, that's just putting all that, there's a lot of different combinations there, but just as an example, it'll be easier for her to bond with a woman therapist many times because she's not afraid. But later on, at near the middle and the end of the treatment, there'll be this thing that usually comes up with like, you did not really helping me. Woman therapist, woman client says, you're not really helping me. You can't really do anything. And that's because it's being projected onto them, that person that stood by and didn't do anything, that didn't stop it, that was impotent, that couldn't do anything. Now, if that same client has a male therapist, they'll have a very difficult usual time in the beginning of building trust. But once the trust is established, which could take months, then it's a natural corrective emotional experience. And the person can realize, wow, you're a man who's not hitting on me. That kind of corrective emotional experience can be very healing. And then the therapist has a harder time sometimes dealing with the anger that comes up at that person that should have stopped it, that didn't stop it. But in the beginning, the fear is there of the male therapist, but there's also this idea that potentially they can do something. They're more powerful. That's a projection because of what happened to them. But what I'm saying is you need to understand the psychodynamics that come up because of the ways things came down. The psychodynamics of it creates transference and counter-transference and your own personal things. And sometimes those cases, you need to develop more types of responses to that because you got to really analyze it very much in depth. Each person is very different, but there are patterns that you'll start to see, especially around gender or age or if a person was abused by a man with a white beard, things like that can be really hard in the beginning, but once you work through those things, it can be a corrective emotional experience. So sometimes being like the perpetrator in the beginning is very difficult. This is something we really want to talk about in the class. That's just a little bit of overview now for us to kind of get going. And we're going to have a poll in this first class, but I wanted to introduce you to some concepts first. Okay. And I'll be available after this, watching this video to answer your questions.